I'm joined this afternoon by the head of the Detroit Economic Growth Corporation, Kevin Johnson, along with two of the great entrepreneurs in this community, Tara Young of 44 Burrito and S.B. Thomas of Sweet Potato Sensations, who are two businesses that are fighting to stay afloat in the middle of this pandemic, and of course Denise Fair, our health director. Let me start with taking you through some numbers, and we're going to talk about what we're doing next in the city of Detroit for testing. So we have reported today a total of 1,220 residents of this city have died since the beginning of the pandemic in March. That is only 5 more than yesterday, but it's still 5 important members of our community that are not with us today. As we look at the progress we're making, I will keep saying this, Detroit is dropping faster than anybody in the country, and I tell you, it's because our residents are wearing the masks and our social distancing. I drive around this region, and there is no city that is committed to the mask and the social distancing the way Detroit has, and the numbers continue to show it. And I'll keep saying the standard should be, can we cut the rate of deaths every week? It wasn't that long ago we were talking about them doubling every week. Now we've gone from 285 to 242 to 154 3 weeks ago to 81 a week ago to 44 in the last 7 days. We are continuing to beat this. We haven't seen a sign of it spiking back up. We brought a lot of our city outdoor crews back. The construction is starting. The manufacturing is restarting. Everything that we are doing is being done in the medically safest way possible. And so I want to talk today about our employees, about 2/3 of whom are on the job today. So city employees deliver service. They've got to show up to work to do the job for you. And I will keep saying this. My goal that every department head knows, we test every day and check the numbers. I expect it to be safer for our employees at work than it would be if they stayed home. With the controls that we have in place, the testing, the temperature checks, the masks, the gloves, the distancing, you should be able to come to work and know you're safe. And we're going to keep checking this every day, and if it goes up, we're going to deal with it. But just since Monday, we have tested 260 employees. Great majority are in the police and fire department. Some are from DDOT, some are from the health department, and some from other departments. 3 have tested positive. The other 257 tested negative. 1.2%. When you go through the fairgrounds right now, 7 to 8% of Detroiters are testing positive. Basically right now, 1 out of 12 Detroiters is infectious. Most of those who are infectious don't have any symptoms, so they don't know it, but about 1 out of 12 is infectious. But of our city employees, we're running at a 1.2% rate. And in fact, the last 40 firefighters and EMTs who tested, not one tested positive. We are being very careful. And so I want to say this to our employees. You are coming to work to serve this community, and we're adding on another policy now for you. Any city employee who tests positive, we are going to ask the members of your household, if you want them to come in and be tested on the Abbott 15-minute machines. And so the way this is working now, the 260 folks there came through our testing center at 100 Mac. They went through the Abbott machines. 3 of them tested positive. And those who have been through this process know if you test positive, you're sent to the room with the nurse where we provide for your medical care and the next steps. What's going to happen now is any employee who tests positive, that nurse is going to say, do you live with somebody? Would you like the members of your household to be tested? And we will get them in by the next day so that you know what the status is of the other members of your household, so you can quarantine properly so you don't have to worry about it spreading to your family. So I just want every city employee to know we're going to be watching out not just for you, but the members of your family. Hazard pay update. When we put in the hazard pay, I said that it would stay in place as long as the coronavirus pandemic was there with the stay-at-home orders. Now the governor has got a phased approach, but when I started it, our employees were testing positive at an 8 or 10% rate. Now it's clear when you only have 1% of our employees testing positive, the basis for the hazard pay, particularly when we have 2,000 employees on furlough or work share, isn't as much. So here's what we're going to do. We will continue the hazard pay as long as Michigan remains in phase 3. So the governor has us now in phase 3, which is the flattening phase. When she transitions Michigan to phase 4, which is the improving stage, we're going to end the hazard pay. We probably are going to be continuing it 2 or 3 weeks longer than there's really a hazard, but we started it 2 or 3 weeks later probably than we should have. And so I think you know that some point this summer you're going to get a check, because we didn't bring the payroll people in from home to all sit together to calculate the higher paychecks. So probably around July 2nd, you will get a lump sum payment for the hours that you work during the hazard pay. But you can plan on this, that at whatever day the governor moves us to phase 4, the improvement stage, that will be the day that the hazard pay per hour bump will stop. So it's still continuing today. We're about to dramatically expand testing at the fairgrounds. And I want to talk to you about why we're going to expand effective tomorrow. Because here's what has happened. Early on in this, when the hospitals were overwhelmed, we all heard of stories of people in their 30s and their 40s who got COVID-19 and who died, and people who we all know, people certainly that I knew. That was a time when the hospitals were overwhelmed. But here's what's happened since May 1st. Since May 1st, we have lost 78 of our neighbors. Here's what we know. Only 2 residents of Detroit under the age of 50 have died this month, 3% of the total. Another 10 between 50 and 59, 13%. But where we've been losing most of our neighbors is in the ages of 60 to 69, 70 to 79, and 80 on up. As you can see, 84% of the Detroiters who have died this month were age 60 or over. And so everybody's infectious, children included, but as far as the way it's attacking our bodies, the attack on the breathing, the clotting, so much more we're learning, is much more fatal to those who are over the age of 60. And so we are ramping up the fairgrounds testing once again. We will be up to testing a total of 2,000 people a day in the city by next week. And so starting tomorrow, we are opening this up beyond the folks we've tested already. Today, if you got a prescription, you can be tested. If you're an essential worker, you can be tested. You've been doing that all along. Starting tomorrow, anybody age 60 or older who's a resident of the city of Detroit can get a free test. Don't need a prescription, don't need symptoms, don't need anybody to tell you it's okay. If you're 60 or older and you're a resident of the city of Detroit, you can get tested by driving through tomorrow. And the phone number's there, 313-230-0505. You can call right now, schedule an appointment for tomorrow, for Friday, for Saturday, for Monday, whatever works for you. If you don't have a car and you don't have a ride, we have got the 8 Honda specially designed vans with a negative air pressure that will take you for $2. And if you don't have the $2, they'll take you anyway. So even if you don't have a car, call that number, tell them you need a ride, and they will book the ride for you when they book the appointment. So if you or somebody close to you has been worried about this, wondering if they had it, now we are the first place in the state of Michigan that on a large-scale basis just says, come on in. And once we get through those 60 and up, who are the highest risk, we'll extend it to 50 and up, and ultimately to everybody in the city. And this has been my goal all along. I want every single Detroiter, whether you've got a doctor or not, whether you've got insurance or not, every single Detroiter who wants a test should be able to get one. I'm really pleased that we are being helped by a number of community activities. Reverend Horace Sheffield has set up centers. Mitch Albom has set up a center in Highland Park. We've got some drugstores starting to open up centers. Dr. Phil Levy at Wayne State has opened up centers. You're going to see neighborhood centers start opening up in the city, and that's a good thing. Right now, though, the surest way to get in and be tested quickly is at the fairgrounds, and I think by now you've heard it's very efficient. You're normally all the way through the entire process in 20 to 30 minutes, but you do have to have an appointment. So if you call Quicken, we'll book you. Now, you have to be a resident of the city of Detroit. It's the only qualification. I wish we had the resources to test suburbanites, but now there's a number of suburban testing sites. This is for Detroiters. So the only thing you have to do, if you're 60 and older, you don't need a prescription, you don't need a doctor, you do need to live in the city of Detroit. And so when you call, we're going to tell you you're going to have some proof that you live in the city. So a driver's license, your state ID, your City of Detroit municipal ID, or any document you might have that would show your address in the last 30 days. A current utility bill, a pay stub, a lease agreement with your address on it, a credit card statement with your address on it. When you call to book your appointment, tell them what ID you were using. We will take anything within reason. But this is something that the City of Detroit is doing. The City of Detroit is fronting the money on, and Detroit residents have been very much at risk for this disease, and certainly our seniors have been at risk. And so we are stepping up as the City of Detroit. If you can show you live here, we are going to get you tested as quickly as you want to get tested. Now, Denise Fair, as she's been talking about, is in the process of going through every senior citizen housing project in this city. And she will come into those housing projects with the testing teams from the fire department and Henry Ford and the health department, and they'll do the swabs right on site. And so you can wait, if you're in a senior apartment, until they come, or you can call tomorrow. If you're wondering on how to make a decision, these are the senior apartments that Denise and her team will be in by the end of next week, either this week or by Friday, May 22nd. If you live in one of these, I expect the health department is going to come to your building this week or next week and test everybody who wants it. So if you live in Bowen Place, Rivertown Assisted Living, Lexington Village, Village Center, Faith Manor, Cambridge Towers, Central Towers, Elmwood Towers, Tome Rivertown Neighborhood Housing, Ellis Manor, Dickerson Manor, River Park Village at the Whittier, Connor Creek, Jefferson Meadows, Himmel Hoke Apartments, Village of Harmony Manor, Parkview Place, Washington Boulevard Building, Wellington Commons 1 and 2, Van Dyke Center, Restoration Towers in Hartford Village. I expect by Friday of next week, our team will have come onto those sites and tested you. If you're not on that list, they're going to get to you sometime by the middle of June. But you may not want to wait for that. You may want to call the fairgrounds and go tomorrow. All I'm saying to you is, if you live in one of the places I just listed, they may be showing up at your place anyway in the next couple days. If you want to say, I don't want to wait for them to show up at Jefferson Meadows, I want to call tomorrow, go ahead and book your appointment. Nothing is saying you can't do that. I just don't want you to go through the drive-through testing site on Monday, come home and find the health department in your building, and you say, how come the mayor didn't tell us they were coming here? So I'm telling you that between now and Friday next week, I expect the health department will come into these buildings, and so you may want to wait. So that is what we're doing on our testing. Detroit has been leading the country in reducing the spread of COVID-19, and now with the open testing of everybody over the age of 60, our highest risk population, I expect us to extend our reputation. We are spending now most of our time as we get the testing and the social distancing under control, focusing on how we get jobs and businesses reopened safely. And the governor now has us in phase 3. And so by now I think people understand landscaping, construction, those types of jobs are approved. The manufacturing is starting now. Phase 4 is going to be pretty much the retail businesses. It's going to be the shoe stores, the bookstores, the art stores, the clothing stores, places that you can go in, buy something, and leave. And then phase 5 will be sit-down restaurants. What we are attempting to do is 2 things. One is get financial help to these businesses until you're able to reopen. And then for those in phase 4, Kevin Johnson and his team next week will be rolling out very detailed plans. I don't know what day the governor is going to declare us in phase 4. I don't have any insight into that. All I know is that when she does, Detroit businesses are going to have more support from us opening safely than anybody else. We will be rolling out those details on how you open as a phase 4 business next week. I also don't know whether barber shops, hair salons, nail salons, or dentists will be part of phase 4. That hasn't been announced. But in those kinds of businesses where there's close person-to-person contact, that does present unique challenges. And whether that's phase 4 or phase 5, the city of Detroit is putting together a program again to make sure that those kinds of face-to-face interactions are done as safely as any place. And so what we will be doing is this. When the barbershops, hair and nail salons, dentist office open up, we plan to take Sunday and Monday and take our Abbott 15-minute tests and set them aside for those people working at those businesses. Whether you're a dental hygienist or a hairstylist, you'll be able to come in every Sunday or Monday, get a test at our Abbott test. It prints out for you your result with a sticker on it. And so you'll be able to say on Sunday, May 20th, or whatever the date is, you can put the sticker up behind your barber's chair, you can put the sticker up behind your dental chair and say, I was tested negative 3 days ago, 4 days ago, and you can come in every single week, because as you think about it, as we reopen these businesses, we need to make sure we reopen them safely so we don't have to close them again. And so these are the kinds of things that we're going to be doing. And so the point at which the governor says it's okay to open up these kinds of stores, the city of Detroit is going to offer you free testing every Sunday and Monday so you can tell your customers that you know that I'm safe, because one stylist could potentially spread this disease to a lot of different people in the course of the week. These are high-risk positions. You're also being exposed to a lot of people coming through. And we'll be talking about masks and gloves and those kinds of protections when the day comes. But I just want you to know, for every one of these businesses, the city of Detroit is going to support you. And that's what Kevin Johnson has been doing and is going to talk about today, is these businesses that you're going to hear from today, and 755 in total, were businesses in Detroit that lost their customers through no fault of their own. Cash flow dried up overnight. We were not going to have a city that when the pandemic was beaten, we open up and there's a bunch of vacant storefronts because the businesses went under. So Kevin Johnson took the lead in raising almost $4 million. It came from Bank of America, it came from MEDC, it came from support from City Council and a number of other places, and offered grants between $5,000 and $10,000 to businesses, just to get them some cash flow to be able to keep them going until they could get their customers back. And I was really pleased with the numbers he showed me, that 81% of the companies that we gave these grants to were owned by entrepreneurs of color. They are being owned by people from this community who look like this community, who are supporting this community. And today, Kevin is introducing 2 of those businesses who can talk how it's helped, how this has helped them keep going. And with that, I'll turn it over to our leader on this, Kevin Johnson.
Thank you, Mayor, and I appreciate the opportunity to update the city about the impact of this Small Business Relief Fund. It is important for us to stabilize what we have, but it's also important to get them to the point where, as the Mayor mentioned, around where we will be at phase 4, and whenever that happens, we want to provide resources to those businesses that we help stabilize, as well as those who weren't, that we did not touch, that will understand what it will take to get open and be viable. There are a couple other statistical things I'd like to share, one of which is 59% of the awardees were female-owned enterprises. 59%. 47% of those businesses that we help award were Detroit residents. I mean, these business owners live here in Detroit, they invest here, and I think that's important that those investments that have happened in our community was retained in our community, and that was very important. We had 1,700 applicants. The mayor and I sat here 43 days ago, Mayor, where we made this announcement about this Small Business Relief Fund, and I'm proud to say that we actually were able to touch businesses that we never had a relationship with before, to provide them resources that we didn't think we had a relationship with prior to this unfortunate event. But now we have information and data so that when we put out the information that the mayor mentioned earlier, that we now have a pathway to get them to the information that they're going to need in order for them to be viable moving forward. So I wanted to share that with our city, and I'd also like to kick it over to Espy, who is an entrepreneur, one of those entrepreneurs of color that was able to benefit from our award. So Espy, I'll kick it over to you, and then I'll introduce Tara after you speak.
Thank you so much. I just want to thank everybody for inviting us here today to talk about this. I'm Espy Thomas, speaking from my mother, second generation business owner of Sweet Potato Sensations. We're located on the west side of Detroit. We've been around for the last 32 years. We're a part of the mere fabric of this city, making everything beautiful happen out of sweet potatoes. When everything first happened, we really took the governor's stay-at-home order super seriously, and we decided to make the tough decision to actually close our business temporarily and just kind of wait everything out. Our staff was afraid, our family was nervous, and we just made that decision. And being closed almost 2 months, when you're not open, there's no revenue coming in. A food-based business, when you're not open, there's nothing coming in, and it's scary. Super scary to be around for so long and be wondering how you're going to make things happen, how you're going to pivot, are you going to pivot, are you going to reopen? What do you do? And so being awarded the grant was just something that helped us put some check marks by some of those built-in expenses, business insurances, inventory rebuilding, deep cleanings we have a fast casual restaurant. And so there's so many different things that we need to take care of, and the DEGC grant just was like a little light, like, okay, we can do something, and feel like we couldn't do nothing. So that was really helpful for us just to get us started again.
Well, thank you. I think that was exactly the intention beyond what we thought would happen, and that's why that grant fund was so important moving forward. So, Tara?
So, I am Tara Young, 44 Burrito, and we are home of the deep fried burrito. Mexican with a taste of soul. This crisis has been overwhelming. Truly, but I am honored, and it is a privilege to be an entrepreneur in the city of Detroit, and for you all to reach out to us and help us, DEGC, the city of Detroit, having the mentorships with Motor City Match, reaching out. It's been overwhelming, but I am truly grateful. My team is grateful. My family is grateful. As SB said, as for her and myself, we're a family-owned and operated business. We're a small business. Entrepreneurship, I'm a female, I'm African-American. That within itself is hard. We started off originally, my partner and I started in Rosedale Park. He passed away from a boating accident, but I wanted to continue the legacy of that because it was a great business. I did do that. I, prior to, was a social worker at Beaumont Hospital, so that is my background. I decided to start and continue 44 Burrito, and it's been hard. This crisis, this pandemic, it's overwhelming. People are afraid, which with great reason they should be. It makes you be more cautious, actually. So it educates you in that value. Having you all reach out to give us a grant helped us tremendously. We have a food truck, a 2018 food truck at that, so there's payments to it. It's helped for that. It's helped for utility expenses. It's helped for my employees to reach out for them because, as you guys know, we were one of the essential restaurants that stayed open through the whole, from the beginning till now. So in the beginning, we weren't having any revenue. So having no revenue, but then you want to still be able to give your employees something. And they appreciated something rather than nothing. And then you have to respect the people that had fear, that didn't want to work. So you had to respect that as well. Um, Everybody knows that we're wearing masks, and it's very difficult to cook and wear a mask. So it's hard to do that. Sometimes people do have to take a break, and you may put it down a little bit under your chin. We are using bleach constantly. We are doing that, wiping down things. We are doing the call-in method, which is working. Cinco de Mayo, because we're a Mexican food restaurant, Cinco de Mayo was there, and it was a plus. And thanks to you all giving some relief, a financial relief, that helped us. So we are grateful. What is right now my most trying time is finding employees, and I want to find employees that's purposeful, people that want to build on something, because we are trying to build a brand, and our brand is trying to enlarge itself and being in the city, and that's something that you work on a basis of very cautiousness, because you don't want to open something and then close. So it's pivotal to have people that help you. And I love we're being on Zoom meetings constantly, learning and helping each other. Marketing is very important. So we're marketing each other and we're reaching out to each other. So I've built relationships to other restaurants outside of restaurants, to help the city and what else we can do. And that's very important and crucial at this time. So I want to say my hat's off to you all for helping me in my business and me wanting to help other businesses as well. So thank you.
All right, well, it's two great companies that are reflective of the hundreds in this city, and we're going to be with you every step of the way till we're fully up and operating. And SB, as you know, out in your area in Old Redford, we are widening, we are fixing the crosswalks in Grand River to make it much more walkable and to build the kind of commercial neighborhood commercial district that we want. So we're investing in a big way. We're doing that in Livernois. We're going to be doing it on Kirchhoff over near Van Dyke, and before long on McNichols near Livernois. So we're going to keep investing in creating the kind of commercial corridors we want, so when our businesses are opening, it'll be the kind of environment customers will want to come back to. And with that, our health director, Denise Fair.
Okay, thank you, Mayor. So today, we have confirmed 10,001 COVID cases and 1,220 deaths. Now, this is a difficult time for many of our families, and we wish them peace. Now, as a reminder, I do want to share that this data remains fluid as the state and local hospitals and healthcare providers continue reviewing and updating death records related to COVID-19. Now, overall, we're seeing that our weekly trend is going down, and this is really encouraging, but the only way that we can continue this trend is if we practice social distancing, wearing a mask, washing our hands, and staying home. Again, this is the only way that we're going to beat COVID-19. So in Detroit, seniors, we know this, they are the backbone of this community, and the health department has spent several hours developing a strategy to ensure the safety of this community. Now, according to the CDC, those that are 65 or older have a higher risk of severe illness from COVID-19, particularly those who are living in communal settings. So as a continuation of the health department's mitigation strategy for COVID-19, the strategy for seniors, we first began with nursing homes, we transitioned to long-term care facilities, and now we are focusing on senior apartments. It's important to note that there's really no single source for listing all senior apartment buildings, so we had to get a little bit of a help from our partners at BSEED, HUD, and the Detroit Area Agency on Aging. We came up with a list of about 100 senior apartments in the city of Detroit. From that list, we have targeted 70 facilities that currently have reported confirmed COVID-19 cases. So far, we've completed testing in 12 of those buildings, approximately 700 residents, and we are seeing an infection rate of about 2%. and that's based upon the results that we have. This is really encouraging. So the infection rate is a lot lower than what we saw in our nursing homes, our homeless shelters, our adult foster care, and which are all in congregate settings. And we suspected that there's a lower infection rate because the seniors are living alone. And remember that these numbers are still fluid. Testing is ongoing and results continue to come again. But again, what we're seeing is about 2%. We have been proactive, and we have scheduled another 25 facilities between now and the end of the month. So per the slide that the mayor mentioned earlier, if you don't see your apartment building listed, just know we are scheduling, and we will continue to add to the list to ensure that all residents are protected from this virus. Now, not only are we doing testing, but we are addressing the PPE needs and also providing infection prevention control education to the staff. As I mentioned on Monday, this is going to be a massive undertaking. It's going to take about 5 weeks to test about 8,000 residents, and we have a solid team in place. So we're partnering with Henry Ford, with the Detroit Fire EMS, the Detroit Health Department, and we're including nurses, medical assistants, and EMS. It's about 30 people that are assigned to this team. So that is our senior mitigation strategy. I really feel good about the direction that we are heading. I want to thank everyone who helped to build the strategy. And with that, I'm going to turn it back over to the mayor.
And so I will, again, make a pitch. As I go around the city, the great majority of people out have a mask. And I will say at this point, everybody in this city, when you're out, should be wearing a mask. All of us here, from the time we leave the house, put on the mask, and it's on until we get home. It's going to be that way in June. It's going to be that way in September. It's going to be that way in December. When I see somebody without a mask, it's not just rude. It's completely disregarding the health of your neighbors. Most people who have COVID-19 in Detroit right now don't know they have it. And no matter what your age is, no matter what your situation is, if you're interacting with other people and you're not wearing a mask, you are potentially spreading a life-threatening disease. And we need to get to the point where every single person in this city who's interacting with others can do this. There's a reason we're showing a 1% infection rate among police, fire, bus drivers, and the like. Our city employees are being completely diligent about their practices and about the mask wearing. And if everybody else in this city did it, we can get rid of this virus. But there have been other places in the world that when the businesses have started to reopen, they've had to close them again because something spiked. It's what worries the governor every single day. We can prevent that spike if we care enough about each other to put that mask on every day. And with that, we'll take any questions, including starting from somebody who I know always wears a mask, M.L. Elrick.
Yes, sir. Thank you, Mr. Mayor. In fact, I forgot it last time we were here. I ran down to the car to get it because it's no joke what's going on out there. M.L. Elrick, Detroit Free Press. Wanted to ask a couple questions about the grant program for those of us who may not remember the details. Can you tell us what the, Mr. Johnson, what the size of the grants were and what the qualifications were and whether or not those are grants people can keep, they can keep if they meet certain conditions, or if that's something that's to be repaid back over time?
Sure. So the grant amount that we raised was $4 million. The amount of the awards range from $2,500 to $10,000. It is not a repayable situation. It's a grant versus a loan. And so that was very helpful to the businesses that were affected by the COVID situation.
What were the qualifications of the applicants?
The qualifications were you had to be a Detroit-based business, you had to be in business for at least 1 year, you had to have at least 2 employees, and then you had to show over post-COVID your profit and loss, so we can see whether or not you were truly affected by the COVID impact. And so that was it.
Okay, and in terms of the number of people who sought these grants and the number of people who were able to get them, I'm sure you had more people who wanted money than you had money to give them.
Absolutely.
Can you give us a sense of what the ratio was to applicants to grantees?
Yeah, so we had over 1,700 applications, and as the mayor mentioned, we awarded 755 grants. So a little more, about half, a little bit more than half received an award.
Okay. And I'm not sure who this question would be for, but do we have a sense of whether or not any of that $15 million that Goldman Sachs was going to handle for the PPP, whether that money's been expended or whether there's still an opportunity for people to qualify for that if they haven't gotten their paperwork in yet?
That was to apply for the SBA loans through the federal payroll protection program. Kevin, do you know if that's still open?
Yeah, so that part is closed. They're going through applications now.
Okay.
We're trying to, encourage those who did apply to finish up their paperwork so it can be processed. But the expending of the dollars, I don't have the exact amount that has been, that's been loaned at that point through the PPE.
The federal program's closed now as
Yes.
far as new applicants.
Yep.
Okay, and are there any other, or do you anticipate any other assistance or support programs for businesses in Detroit, large or small?
Well, obviously, if, with the federal government's, kind of doing the dance around whether or not they're going to do a second round of stimulus dollars, obviously, if that happens, we will be the first in line to try to get our resources around that so that we can assist more businesses. But there's always an opportunity from the philanthropic community that they've already stepped up to step up again to put grants out to our communities. If that happens, we'll rally around our infrastructure to help get those dollars out to the community.
Okay, and so it sounds like that's a to be determined at this
To be
point?
determined at this point.
Okay.
Yes.
And do we have any sense from businesses who perhaps applied for a grant or have just reached out to the city or other entities with whom you're in contact that they're not going to make it, that they've already made the determination that they won't be reopening their doors?
We haven't had that direct communication with the outreach that we've had, but if in fact it does come to that, we will do all we can to find resources, whether or not this is available to us at this point or not, to try to stabilize the business. The whole exercise was around stabilizing the businesses that we have and retaining what we had. So if there is businesses out there that are on the edge, we want to hear from them because there may be resources that they may not even are aware of that we could bring into the mix there.
And how would they contact you?
They can go on our website, www.deg.org, and then there'll be a list of people there that they can speak with.
Okay. And Mr. Mayor, is the city hearing from Detroiters who applied for unemployment, either for the CARES Act or the state unemployment, where they're just not getting through to the state and they're wondering, is there anybody at a local level who can help them sort of break through? I know they've had 1 million people apply, but some folks have been waiting quite a while.
Yeah, and we offer technical advice on making sure that you have the right information and the right paperwork in. The complaints have gone down every single week. So, Jeff Donofrio, who was a part of this administration and we know extremely well, he just didn't have the IT infrastructure to handle, 200,000 at a time. They were geared up to handle 3,000 or 4,000 at a time. But from what I'm hearing from people, it's getting better every week.
Okay, but is the city hearing from people who are just saying, I don't know what to do, can you help me out? People who
yeah.
have reached the end of their
Yeah.
rope and are just,
Yeah, and we help. And, we have relationships, and sometimes you've put in the wrong form, sometimes you can get in the right email address. It's amazing, some of the technical things that have kicking you out. And I think the governor's most recent orders, I'm hearing from people, dramatically eased the ability to get approved. So I think it's going to get a lot smoother. I'm not the expert on the ins and outs, but I know since she issued that last order, we are hearing less complaints. I think she appears to have gotten the process going the right direction.
okay, so it sounds like if somebody has a problem, they should pursue that through the state rather than a local touch point.
People talk to all of us, and we all pitch
Well, I believe
in,
it.
but basically what we have to do is get the state system to work, and it's working better.
Okay. Tomorrow, I think I'll be headed up to Lansing for the next demonstration at the Capitol. I'm wondering if anybody here, based on what you've seen in Detroit, what your experience has been, has a message that you would like delivered to the people who will be gathering to express their concerns or their heartfelt opinions.
Sometimes it's so obvious you can't understand it. I understand that in Clare, Michigan, there is not much COVID-19, and you might wonder, why is your business being shut down? If the governor were tomorrow to say Clare, Michigan is open for business, people would empty out of southeastern Michigan and head up there. And now you'd have these areas of the state widely infected. What the governor is doing is so obviously right, and is protecting the areas that haven't been affected. I really don't get it. But down here, I'm just really lucky to be the mayor of Detroit. This city has been unified from day one in fighting this virus, and so I haven't had to deal with the kinds of nonsense the governor has. I was really pleased to see Mike Shirkey, the Republican leader of the Senate, to refer to those protesters as jackasses, because it was very clear this is not a Republican-Democrat thing. The responsible Republican leadership is as appalled at the behavior as the Democratic leadership. But it's clear to me the governor's doing the right thing, and you can imagine what would have happened. Had she not done this and people poured into northern Michigan, you saw when they reopened Atlanta, 75% of the people who visited the next week came from outside the area. You can imagine if people had poured up into the outlying areas from southeastern Michigan and spread the infection, these folks would be protesting the governor saying, why didn't you protect us? She's doing the right thing. She ought to be supported.
Okay. And Ms. Fair, I think you answered, or you may have answered my question earlier, but my question I'm going to have, I think you may have answered earlier. But in terms of that 2% infection rate in the senior buildings, you said you attribute some of that to seniors living alone. Are there other factors that you've seen that, because 25% to 2% between the nursing homes and the senior homes is I don't even know how to characterize such a difference like that in the infection rate.
You have to look at the individual facilities. If you're in a nursing home where people are clustered in relatively small spaces and eating, if you've been in these nursing homes, in many cases, eating in very close quarters, which is the culture, the spread there versus people living in apartments who make their own meals and eat separately is very different. So we expected it to be lower in the senior apartments. I don't think we expected it to be 2%, at least in summer. Now, we've had some that have been 8 or 9%, but we're seeing a number closer to 2%. And while I haven't been in those buildings myself, I would suspect that you are seeing seniors putting on masks before they're leaving their apartments, using those masks while they're there, and practicing safe distancing. And there's no reason why somebody in a senior apartment building practicing those measures isn't just as safe as somebody in a single-family home. So I was really encouraged, and I'll let Director Fair talk about it, but I know when we saw those numbers come in, it was a cause for some smiles.
Yeah, and I asked the team to recalculate, because 2% to me is extremely low, but it's very much encouraging. And again, that's based upon the 9 facilities that have reported so far, but I imagine the numbers won't change very much. So again, it's a really solid team, and we're going to continue moving forward.
Okay, and these are residents where there's no communal dining, no caregivers going room to room to room. This is, you're older and you live there, but otherwise it's just an apartment.
Yeah, these are
Okay.
basically, so they're senior apartments, and the majority of the seniors are living alone.
Okay, and having been in these facilities now, particularly the nursing homes, I know there's a lot to do, but have city officials seen things in there where they've made notes to say, you know what, we need to go back there and make sure that they take care of A, B, C, and we're going to give them a little time to know that A, B, C better be taken care of by the time we get back there, because there may be some other factors other than just the age of the residents.
So
Pretty well the whole point.
yeah, I'll have to say, I mean, it's really been eye-opening, and we have built so many relationships now with the nursing homes. They're coming to us saying, I have this issue, how can you help? What we found is that the nursing homes needed a lot of PPE, and we met that need. They needed education, we met that need. And this is something that's not just one and done. We're going to continue to provide them the support that they need.
I guess I'm thinking of issues that have nothing to do with the coronavirus, maybe sanitary issues, the state-of-the-art, amenities, what have you.
No. I mean,
Yeah, If you go into a senior apartment, there's a good chance there's a complaint about the manager over the windows or the air conditioner or something. That's true in most buildings, but as far as what we have seen in the nursing homes, we've seen professionals respond. This has not been an adversarial process. Once we came in and they saw we were there to help, it's been very collaborative, but there's no doubt that the checks they made were, we're going to go back and make sure people have been properly isolated as they were supposed to. We're going to go back and make sure people are using the PPE that we gave them. Those kinds of follow-ups is what the health department's been doing, and we're seeing a lot of commitment of nursing home leadership, deeply concerned about the care of their residents.
Okay, and I guess my question, the essence of it is, were you finding that the facilities, while you were in there to see one thing, did you find other things that may have raised some concerns or that you think need to be addressed that have nothing to do with COVID-19?
Not that I'm aware of.
Okay, great. Thank you very much.
Just a couple of general follow-ups. One for ESPY. You'd mentioned that Sweet Potato Sensations had closed down temporarily, but you are reopened now, right? And would you like to share your current hours?
Sure, so we decided just to take it slow, to reopen slowly. We're open the weekends, Friday through Sunday from 12 to 6, and we're on Losser in Grand River across from the historic Redford Theater.
Okay. And Tara, I don't know if you want to share your hours as well.
Okay, so we're closed Sunday and Monday. We're open on Tuesday, Taco Tuesday, of course. We open at 11. We've been closed. Our hours have been different because of the coronavirus. So our hours are usually 11 to 7. Friday and Saturday, we are open till 9.
Okay.
And we're on 8 Mile.
Thank you. And Mayor, one question on the expansion of the testing access at the fairgrounds. If there are multiple people over the age of 60 in one household, can they schedule appointments in tandem?
Yeah, absolutely. Call up, and if you got somebody else in the car with you, it makes it that much easier.
Okay, great. That was the last question.
All right, thank you.